Do you see the recording thing? Oh, there it is. Okay. Hello, everyone. This is our completed master's thesis on the effects of postpartum depression on the family dynamics. I'm Mikaela Rock. This is Taylor Collins and Belinda Young. So this study addresses postpartum depression's impact on the family dynamics. A mixed methods design was used to first collect quantitative data and then follow up with qualitative data. So during the quantitative data of this study, the Edinburgh Postnatal Depression Scale and other questions regarding risk factors, parental relationship before and after childbirth, and child development were used to collect data from women who have had a child between January 1990 and January 2020. During the qualitative phase, follow-up interviews were conducted to explore maternal mental health post-childbirth with participants who volunteered.
Okay, we want to make sure we thank the students, faculty, and staff at Tennessee Wesleyan for being such big supporters of us as we go through this research process, as well as the IRB board, the IRB. And then we also want to put a special thanks out there to all the participants that took the time to complete our quantitative and qualitative parts, our thesis chair, Dr. Rebecca Alfeld, and our thesis reader, Miss Whitelaw, and any family and friends that supported us along the way.
Postpartum depression is a type of depression experienced by the mother following childbirth, and this depression can arise from a combination of hormonal shifts, role changes, fatigue, and many other aspects. As mental health is becoming an emergent practice for occupational therapy, this research promotes knowledge and awareness of postpartum depression within communities across the United States. For OT, this area of practice can better help mothers and families by identifying the risk factors of postpartum depression and disrupt the disease process with specially designed interventions that are centered around mothers and their families' needs. The main topics this research focuses on are risk factors for developing postpartum depression, women who were diagnosed versus women who were undiagnosed but should have been with postpartum depression, and how postpartum depression impacts the dynamics between the partners and how it affects child development. Overall, this research aims to identify OT's role in PPD when assessing its effects on the family.
Okay, implications for OT practice. So OTs can help to create interventions to reduce the effects of postpartum depression on women and their families. We can also implement assessment tools such as the Edinburgh Postnatal Depression Scale to those that are at risk, or to be able to better identify symptoms early on. We can also collaborate with the interprofessional team to better understand the family dynamics and work to reduce the risk for mothers for developing postpartum depression. We can also serve in low-income areas to increase the testing and treatment that is very much needed in these areas.
So for our literature review, we broke down one article per subsection that we felt most applied to that specific section. For risk factors and diagnosed versus undiagnosed postpartum depression, we chose an article that focused on the Edinburgh Postnatal Depression Scale. So this was a level 6 qualitative study that looked at 8 public health nurses who have an extensive background in implementing the EPDS. They were interviewed using a semi-structured format, and 4 key themes were identified from these interviews. So first, that the perception that screening puts mothers' mental health on the agenda. Second, that the subject of postpartum depression screening is considered less invasive when it is a part of just the standard routine for new mothers. Third, that This scale picks up on what the gut feeling misses in a clinical setting. And fourth, that this scale should also be implemented with clinical judgment for the best screening tool possible. So overall, the results found that this is a valuable tool when screening for postpartum depression, which is why we decided to use it in our study.
Okay, and then for a research article that was related to partner relationships, so I chose this one. It was a level 6 qualitative study. It included parents that have experienced depressive symptoms and parental stress. It consisted of open-ended questions with 10 mothers and 5 fathers. And the questions were changed based on their narratives and their stories about the questions they had originally asked. There are common themes found from the interviews with the participants, one of them being the experience of spouse relationship problems. Mothers reported their relationship with their partner as strained after having their children. So the mothers reported feelings of abandonment, loneliness, disappointment, bitterness, and just felt fully responsible for their child. And they felt that this was what put a strain on the relationship. The fathers felt that the lack of intimacy and sexual desire is what put a strain on the relationship. So I felt that this study was very important for our research because within the interviews that I conducted with our participants, I found a lot of the same themes with the mothers as well that were also related to this study.
And for our subsection about child development and the effect that PPD can have on that, we focused on an article that used a level 2 longitudinal quasi-experimental type, and it looked at the behavioral problems that children can have caused by postpartum depression in the mother. They used high-risk families. These families were in Germany, and they used a lot of different interventions. They used a parental questionnaire, the child behavior checklist, the emotionality, activity, sociability, temperament survey, and the Heidelberg Stress Scale. And their outcomes, they found that there was a significant correlation between maternal depressive symptoms with infant regulatory problems and internalizing and externalizing behavior issues within the child. They also found that as mothers' depressive symptoms went up, there was also more issues with the child's negative emotionality, their shyness, and their behavior problems. And the way that these results can be used, it shows that early intervention, especially in families that are high risk and in the low SES bracket, can benefit from treatment and just awareness in general so that the children don't suffer from different social development and limited mother-child relationships.
All right, so our research question was, how does postpartum depression affect the family dynamic? So the objectives of our research were to identify the risk factors of getting postpartum depression, identifying the process of diagnosing mothers, identifying the effects on partner relationships, and then identifying the effects on the child's development. And overall, we want to just find if occupational therapy would be beneficial to pregnant women and new mothers who are at risk for developing PPD for them and their families.
Okay, so for our design, we use an explanatory sequential design, and that is a design that goes in 2 phases. The first phase is going to be collecting quantitative data, and then we're then going to use the quantitative data to collect qualitative data on the participants. Although we had 69 people respond to our survey for quantitative data, 52 of them met our inclusion criteria. And from that, we had 2 participants that agreed to participate in the qualitative section, and that was done through Zoom and email. All of the data was collected between December 2021 and February 2022. So we used different tools during our study. As we talked about earlier, the Edinburgh Postnatal Depression Scale was our gold standard. And although there isn't a specific cutoff that is like set to decide if it is positive or negative for postpartum depression, we looked through the articles that we utilized to get our background literature, and we found that a score of 10 or greater was often used to signify a positive postpartum depression score. So that's what we decided to use for our survey. And then we used interview style questions. These questions went over mother's emotional and physical state, intimate questions regarding the relationship with their partner, and question about the child's development, mostly behavioral. And future research would benefit from more qualitative data. Since we only had 2 participants, I feel like qualitative data would really be useful for a bigger picture of what's going on for these families and the relationships between all the members. Okay, and I wanted to go ahead and give you guys an idea of what our participant pool looked like. So as you can see, a lot of our participants were white, non-Hispanic, and it is an interesting thing to note that all the minorities within our study were not tested for postpartum depression formally following childbirth. So their scores were based off of what they recall now. And then our income brackets were actually very well spread out. Geographical location was mostly the Southeast United States, which can be explained from the fact that all 3 researchers are also from that geographical location. And most of the participants were married, with a few of them not married, varying from being with their father or not with the father anymore. Okay. So when we're looking at our quantitative data, it's interesting because we actually found that 77% of our 52 participants had a positive postpartum depression diagnosis. And that's interesting because most of the articles we looked at said that it was between 15 and 20 for a national average. And a possible explanation for that might be that of our 52 participants, 30 of them were not tested. So it seems that there's a lot of mothers not being tested. So the numbers could be skewed in that way. We also found that there were significantly higher EPDS scores for those that were tested, which is quite interesting. We found that the highest postpartum depression severity was in the highest and the lowest income bracket. Although it was not statistically significant, it was several points above the median income bracket that we showed in the past slide. And then we also found that significant higher change in frequency of sexual intercourse between partners did happen for the mothers that had higher postpartum depression scale scores. There were no significant differences found in relation to the child behavior problems. So that is unlike the research that we found before, but that just is motivation to find more research and keep going. And then for our qualitative data, we found a few themes between the 2 mothers. It was loneliness and shame, expectations of mothers and their partners, roles as mothers and fathers, intimacy, and lack of support and education related to their postpartum depression diagnosis. So one of the mothers was formally diagnosed, but didn't feel that she got enough help in regards to the diagnosis that she got. And then the stressors that came along that may have led to their diagnosis, changes in roles as a wife, hormone changes, low self-esteem, new expectations that were not effectively treated by their healthcare providers. So both mothers felt like they were experiencing depression but weren't getting the treatment that they needed to get better and improve the lives of them and their family.
In terms of limitations and biases, just in general, addressing the subject of mental health can be difficult because of the stigma surrounding it, which could have affected the participants' willingness to answer their survey questions openly and thoroughly, even though it was anonymous. Since this study asked mothers to reflect on their pregnancy if they experienced one between January 1990 and January 2022, mothers in those earlier years may not have been able to recall accurate answers based on their experiences since it would have been so long ago. And like it was said before, the EPDS is a non-standardized tool where various cutoff scores can be used to determine if postpartum depression is present. So several studies can produce different results based on the chosen cutoff score. And it also does not cover physical ailments that may result in depression. In terms of our study, this study had a small sample size with most participants living in the southeastern region of the United States, which is not an accurate representation of the population as a whole, especially when considering low-income areas where mothers may not have had the resources to access the online interviews. And then in terms of the current literature, there are very few studies that assess how postpartum depression affects the family and child development, which makes it difficult to understand the true impact of this diagnosis on these dynamics.
Okay, in summary, so I think it's always important to have more research, especially with this topic. So this can include mothers and fathers and the tools and resources utilized in practice today to better help the future. And then also just more research regarding OT's role. So hopefully as OTs come into this role, into this practice area, we can create more research to also just better the future for OTs in this area and for mothers and their families. Definitely more policies to further help new mothers and their families could also be implemented, and then more education and support within the overall healthcare system. And then we can utilize this research and past research to place more OTs into this practice area, as OTs can provide more holistic and unique approaches to this area with the goal to alleviate some of these negative effects and help these mothers and their families. And here are our references.
Thank you.
Thank you.
Thank you.